Hi, I'm Roamy. Today I'm going to show you how to use the Beco 8 carrier to carry your child on your hip. So here I've got the Beco 8 carrier and I've got it adjusted to the widest setting because the demo doll I'm using is around 9-month-old size, but you'd use it on whichever setting you'd normally carry them facing inwards on your front. So if you're still carrying them on the narrow setting facing inwards, then you use that setting for the hip and vice versa. So what you're going to do is you're going to put this on as normal, so folding this piece down and bringing the straps around like this. And now what you're going to do is you're going to choose to sit it halfway between your centre and your side. So basically, 45 degrees around from the centre, and tighten it up. Now you've got your lumbar support here. Depending on your build and size, you may find you can still keep it in the centre of your back, but if you're more petite, you might find it's easier to take it off. So whatever feels most comfortable for you. You can either take this off or leave it on there. And you're going to sit the carrier wherever you'd normally have it on the front. So I'm wearing it down on my hips because when I hold my child, that feels where I'd like to hold them. But obviously it depends on your torso length as to how high you sit it. So have a play about with different heights and see what works best for you. So I've got this sat 45 degrees round from my front to my side. I'm now going to pick up my doll. So as I said, this demo doll is around 9-month-old size, so their legs are wrapping around me. So I'm going to hold them on my side and just check that the carrier is sitting evenly between each leg. If you need to, you can shift the carrier around a little bit, one way or the other, so it's sitting evenly. Okay, check you're happy with the position you're carrying your baby in, and then slide your hand under the base of the fabric and bring it up over their bottom and back. So you're now holding them with the material. Now you've got two straps here. One is basically in the centre of you here, and the other one is towards the back. So the one that's towards the back, you're going to pin underneath your armpit here, and then with the other hand you're going to reach around like this and bring it straight round across your back, all the way across, and clip it in over here. Now the reason why I always do this side first rather than the other one is that the other shoulder strap will then pin this one in place to stop it sliding down. So I've got this going straight the way around here, and you want it going fairly high if you can. You then want to tighten it up, so you can either tighten it by pulling this one or pulling this one, whichever feels more comfortable for you. So I'm going to pull that one there. Okay, get this one nice and snug before you do the second one. Now this one is going to go over this shoulder. Most babies tend to like to have their arms out for this, so if they do want to have their arms out, just make sure they've got full head control before you do so. If they haven't got full head control, keep their arm inside. So I'm going to bring their arm outside. Now this strap is going to go over this shoulder and then round to the opposite side. So I'm going to check this is nice and long. Lengthen it a little bit. Put it over your shoulder like this. Then swap hands and hold your baby with the other hand. And with this hand, you're going to reach round and find this strap. Pull it straight down to hold it in place on your shoulder, and then bring it around and clip it in round here. Like this. Okay, and again, you can either pull this one backwards or pull this one up here down in order to tighten it, whichever you prefer. I find it easier pulling back, but it's totally up to you which one you find simplest. So, the checks are the same as if baby was facing inwards. You want to check you can see their face and they've got clear airways, and check they're held nice and secure. So one way to check is just hold them in your arms. If you feel you need to lift them, then tighten it up accordingly by pulling on this one and this one. The other way to check is rest your hand on their head and just gently lean forwards and check their body doesn't pull away from you. You want to ensure the carrier sits no higher than the nape of their neck and no lower than their armpits. So the carrier can come up to here, or it can come down to under their arms. Make sure it doesn't sit any lower than that. They can choose to have one arm in and one arm out, or they can have both out or both in, whichever they prefer, as long as it's at least to their armpits. Position wise, just check the carrier is fitting evenly from one side to the other without overextending their legs. So just check it's fitting from one knee to the other. If you need to shift them, you can shift them one way or the other like this. And you want to make sure their bottom is nice and low compared to their knees. So if you need to, take your hands and slide them inside and give a little tilt just to bring their knees up and curve their bottom around, just to make a nice comfortable position. And that's how to use the Beco 8 for a hip carry. So to take baby out, we're just going to reverse what we've done. So I'm going to unclip this one and feed it back through the elastic, like that. And do the same with the other side. So unclip, feed it back through the elastic. And then you can bring the straps over your shoulders and lift baby out. I hope that was helpful.